The United States healthcare system was deemed the worst overall in a new analysis of 10 similar countries by a leading health research nonprofit. Mirror Mirror 2024, Portrait of the Failing U.S. Healthy System, published by the Commonwealth Fund Thursday, looked at 70 healthcare systems in 10 wealthy nations, including Australia, Canada, the UK, and the US, and compared them to one another. The nonprofit has conducted and released an international health policy survey since 2004. In the survey, the U.S. system came in last place overall, in part because it earned 10th place spots in both accessibility and healthcare outcomes, as well as low rankings in administrative efficiency and equity. 20 years later, this report reveals our healthcare system continues to lag far behind other nations when it comes to meeting our citizens' basic healthcare needs, said Joseph Bentcourt, president of the Commonwealth Fund, in a call with reporters. The Commonwealth Fund chose to focus on affordability and availability when it ranked healthcare systems on their accessibility. The Netherlands, the United Kingdom, and Germany are ranked first, second, and third, respectively, for healthcare access in the survey, with Switzerland and Australia earning the eighth and ninth spots rather. In the Netherlands, visits to primary care, maternity care, and child health care providers are fully covered by their insurance, and other healthcare services are covered in the country once patients pay an annual deductible, according to one of the country's largest insurance providers, CZ. The United Kingdom's National Health Service, oh, that's one of the best ones, offers Brits free public health care, including hospital, doctor, and mental health care, while in Germany, co-payments are capped based on income, according to the country's public health insurance company, Krankenkassen. Germany and the Netherlands both have systems in which some physicians are required to work after hours to ensure that people have round the clock access to care, according to the survey. Affordability is a major barrier to healthcare access in the U.S., per the survey. There are still at least roughly 26 Americans who do not have health insurance. You're looking at one of them, according to KFF, who are expected to pay for all healthcare costs out of pocket. Americans with health insurance also still face significant financial hurdles when paying for healthcare. The out-of-pocket limit for market health insurance plans under the Affordable Care Act was $9,450 for single adults and $18,900 for family plans in 2024, according to the survey. And remember, this is an era where most people can't afford $1,000 emergency, but whatever. Over 40% of Americans spent $1,000 or more on healthcare out of pocket last year, according to a 2023 survey from the Commonwealth Fund. Americans are also far more likely to say they do not have a regular doctor or healthcare clinic to go to compared to people living in other countries, including the analysis, according to the survey. A recent Yahoo/YouGov poll found that 77% of Americans say they have a primary care physician, while 20% said they do not, and 40% are not sure if they do. Americans also have limited options if they need to seek medical care after regular office hours, while many other countries have taken steps to ensure 24-hour access to providers. For example, in Germany, doctors are required to provide after-hours care at their practices, and in the Netherlands, general practitioners have to work 50 hours after normal business hours a year to keep their licenses, according to the Commonwealth Fund and National Health Care System profiles. The nonprofit looks at each country's life expectancy at birth, rate of avoidable deaths, and excess deaths due to the pandemic when determining its health outcome ranking. Australia, Switzerland, and New Zealand earned the top three rankings using these three metrics. Americans have the shortest life expectancy at 77.5 years out of all 10 countries included in the survey, and has the highest rate of preventable and treatable deaths. The U.S. also has the highest number of excess deaths linked to the pandemic for people under the age of 75 of all 10 countries. Drug overdoses and gun related deaths are also far higher in the U.S. than they are in the other wealthy countries, contributing to the country's poor health outcomes, the survey notes. Drug overdose deaths have been declining in the U.S. in recent years, but more than 107,000 people died from overdoses in 2023, according to the Centers for Disease Control and Prevention. And nearly 43,000 people died from gun violence the same year, according to a report from the National Institute of Healthcare Management. The U.S. has its healthcare problems, but none of the countries in the analysis are perfect, the survey notes. Readers should use caution in drawing conclusions when comparing countries' overall performance, the survey reads. Each country has areas of higher and lower performance, and all countries have something to learn from one another. They can learn from the U.S. how to complete the insanity of turning healthcare into something that's not accessible for a good chunk of its people, like tying it to your job or having to work somewhere to even be able to possibly access it. This is such a every now and again there's a news story that if we actually had news organizations that were worth a damn, CNN, ABC News, Fox, MSNBC, if they were worth their salt, they would be covering this all day long, every day, having panelists, people. Because think about this: the United States comes in dead last among wealthy countries when it comes to one of the most important things that a nation can provide for its people, which is its health care. And that's not major news. That's not shattering the airwaves. People aren't lining up going, what in the world? How does that happen? The truth of the matter is, a lot of people, we talk about like how the Republicans call single payer, socialized medicine and your Venezuela and all this other, garbage. But the truth is, a lot of people on both factions, more Republicans and Democrats, but still don't actually know about the healthcare of other countries. Like they know what Germany is, right? But they don't know that, they don't have to put up with the shenanigans that we have. They know what the UK and Canada are, but they don't know if they have single payer. They don't know how their manner of doing things, is conducted. It's interesting when you just think about that, how people are just so unaware of how much better things can be in other regions. I mean, what do I even say? Sometimes when I read these articles, I'm always worried there's a part of it that I'm going to, yeah, the National Health Service in the UK. I guarantee you could go and ask most Americans. They know what the UK is. They don't know about the National Health Service. They have no idea what that does. And I've always said, like, healthcare, I don't know why, well, I do know why, the for profit industry, but healthcare should be just like any other public good that we all pay for with taxes and then get to use. When you have your house burning up in a fire, you call the firefighters, they put it out. You don't have to pay them on the spot. I mean, it's stupid that it is. It's stupid. It's cruel. It's corporate greed. Those are the reasons we don't have single payer or even a public option. God, man, it's sad. Richest country in the world, or one of the richest countries in the world, and we have the highest number of preventable deaths. I'm not surprised we got a low ranking in administrative efficiency and equity. I mean, if you get sick after 10 p.m., you're supposed to just hope that whatever illness you have is what not going to bother you until 6, 7, 8 a.m. the next day, 9 o'clock, 10 o'clock. And this is actually one of the reasons why when Bernie was proposing Medicare for all and talking about wanting to expand healthcare coverage to cover teeth, dental care and and eyeglasses and many of these other things. It's because a lot of these dental centers and other places that have to deal with teeth close at a certain time of day, and once that happens, you're just left with the pain of your tooth until I guess the next day or whenever they decide to open up again. Um, that's something that people don't talk about. That you really in a country that is trying to keep its people healthy, you need people that work overnight, work in the morning, work in the afternoon, work during the early evening. Like you need 24-hour care because 24 hours of the day somebody might get sick. It's that simple. And one of the other things that's stands out to me about the article is where they mention that, I mean, they're, these other healthcare systems make me just embarrassed of mine. Um, think of how sad that is. 26 million Americans who don't have health insurance. In one of the richest countries in the world, one that can send billions of dollars overseas every year to go, bomb some country that most of us can't even find on the map. We have 26 million people who just don't have health insurance. If your arm starts hurting tomorrow, get ready to pay however much for the doctor to fix it. Or, I mean, it's lunacy. It's insane. And there are people. There are, like, what we know politicians are going to go and cape for their donors, but there are regular civilians. This is the saddest part. There are regular voters that are fine with this, that will keep voting for politicians who have no plans of addressing this. And all you have to do to get them to support you is talk about immigration or some other crap that completely obfuscates from the daily problems that we have. We have daily mass shootings, which is why one of gun deaths is one of the preventable deaths they talked about, one of the higher ones anyway. And you won't see any politicians talking about it unless it's in national news. We have, again, over over 2 dozen millions of people that don't have health insurance. You're not going to see any, well, except Sanders, but you're not going to see most politicians addressing that because they don't give a damn. They have their insurance. But this story just really, it depresses me, both for the fact that it's another one of those statistics the U.S. should feel embarrassed about, right? And the fact that it's another one of those major stories that will not get covered by mainstream news because they don't give a damn about informing the public of things that actually affect us.